Dr. Paul, I have got a throat and a story. You've got to hear. Well, you're going to see the story. No, you're not going to see the story. You're going to see the throat and you're going to hear the story. Let's go take a look. Hey, how have you been?
Well, not too good.
Not too good? So what's going on?
So about a week and a half ago, I started having a sore throat.
Okay.
It was really, really sore. And I also had fevers.
Okay.
And I'm like, why in the world is my throat this sore?
You actually did spend a night in the hospital, or was it 2 nights?
One.
1 night. 2 days, 1 night.
Yeah.
This young man went through quite an ordeal. So you got here about 10 days ago, and Mom, you can clarify if I'm messing the story up, but basically sore throat, high fevers, got here, it looked really bad. In fact, so bad they gave him a shot of antibiotics, 1 shot in each leg, ceftriaxone, Rocephin, and then they gave you a dose of antibiotics. You ended up in the emergency room like the next day, right?
Correct.
Next day. The rapid strep was negative both places. The monospot was negative both places, I think. But your throat was so bad, the tonsils are touching. You couldn't even see the uvula, the little thing that hangs down. That's how bad your throat was at that point. He ended up being hospitalized because of fear of his airway. And you're gonna see how his throat looks today. But basically you also got a dose of Decadron for the docs out there. You know, it's a steroid and it helped decrease the inflammation. Before I give you the results of what we got back from his blood work, I want you to see his throat first. I have a throat scope, which is a fairly cool tool.
Ooh.
Isn't that nice? It's like my lightsaber. All right, lightsaber. All right, open your mouth real wide and say, ah. Now, I don't even have to get anywhere near your tongue. I just use this throat scope as a light. And you can see at the back of his throat, his tonsils are now just 2+. They're not even close to touching. You can see his uvula hanging down, but at the top of his palate are little red spots. Those are called Palatal Petechiae. Say ah again. Nice. Terrific. Say ah. We even have Palatal Petechiae extending a little bit down to his uvula. Fantastic. Now when I see Palatal Petechiae in the past, when I see Palatal Petechiae, I'm almost certain it's strep. But we're taught in medical school, you're taught in residency, you cannot diagnose strep by appearance only. And I just did another strep throat screen today. It was negative again. That's 3 negatives, and I'll send it off for culture. It'll be negative because we got his blood work back. His IgM was sky high, 130 for EBV Epstein-Barr virus, which is mono. So you have mono.
Right now?
Right now, for sure.
Whoa.
So
It's gonna take about 6 months till it clears up.
not necessarily.
That's what she said. That's the doctor.
Well, so here's the thing, folks, about mono. Standing in this room with you, and even though I was having you go, ah, thankfully you didn't cough into my throat while I was saying, ah, that's happened to me before. I'm not at risk really of getting mono. It's direct contact, so you need to be aware of that. Like, you guys shouldn't be sharing water bottles or food because any oral secretions can transfer to somebody else.
So it's not air.
It's not airborne unless you like cough and it gets
wet.
Yeah. It's direct contact with droplets and all of that. The treatment for mono is boost your immune system, which would be things like vitamin A. If you do high dose vitamin A only for a couple days. Vitamin A in high dose is toxic, so that's why you only use that. But vitamin C is good for the immune system. You can give high dose, 1,000 milligrams of vitamin C a couple times a day for a while. But mostly, the key, this is for you to pay attention to, and I think you've done a good job, is to take it easy and rest. So usually what we say with mono Epstein-Barr virus is no contact sports, and in fact no sports at all. Really reduce your activities until we're sure you're better. So the reason is, I'm gonna have you lay down, bend your legs, and we're gonna feel for a spleen. Just relax. So here's his rib cage, right here. And what we do is, you see the rib cage right there? I'm gonna push up on the back of his behind his stomach here, and then with my fingers, I'm feeling for a spleen tip. You're doing a great job. So you can push way down, folks, if you can get a kid to cooperate. Uh-oh, now I got you laughing. But once we know you don't have a spleen that's enlarged, you can go back to sports is when you're feeling your energy is back.
Yeah,
It
you're
already
right.
is.
So you're gonna get better fast. I have a son who went through this and missed an entire season of basketball, and that was his sport.
I went through this as well.
Oh, 2 sons that went through this. The guy behind the camera went through this also.
Remember when I had to have a spinal tap? That was what that was for. 2 weeks, couldn't break my fever.
Really?
I found out it was mono.
I wasn't a very good dad back then. Oh well.
He did just fine.
To our fans, your fans on YouTube, your best advice for what to do about mono.
Well, I have some advice for you. My mom gave me Tylenol and ibuprofen, and that helped the pain a lot. With
Can
the
I add
rest.
something?
Yeah.
Okay. Good point on it. Sometimes the pain is so intense you feel like you have to do something. Ibuprofen is preferred just because acetaminophen Tylenol affects your detox pathways and we'd rather not mess those up. But yes, if you have to use something for pain, ibuprofen. And
Let me finish this advice.
finish your advice to your fans.
Also, I used magic mouthwash when I was eating because it helped my throat like open up so I could swallow food.
Nice.
Very cool. And for the doctor types out there, when the airway is so obstructed that you're worried about their ability to breathe at night, they might obstruct. That's really the only time you would hospitalize unless there were other complications related to mono, which in this case, clearly we've got a healthy kid. Thanks for watching. I'm Dr. Paul.
There, dude.
Later.
All right.
you showing off the guns?
He's got guns.
Oh, oh,
Whoa,
gun show.
look at that.
Gun show. Gun show?
Oh, let's see. Oh,
Hey!